They all say they look at the root cause of disease. Well, let's examine that strategy, shall we? What's a root cause of a sore throat? Well, if you go to a doctor, they'll do a throat culture, they'll find streptococcus, they'll treat you with antibiotics, and they have the root cause.
Actually, the number one cause of sore throats is a viral infection. I thought you would know that, but anyway. Tried that approach. It really didn't work for me, and if you're watching this, it probably didn't work for you, so keep watching. You know, this whole reductionist approach to healthcare is why so many people remain sick. And here's one of the reasons why. When I was 4 years of age, I mysteriously developed asthma, severe asthma. The doctor said, here's your asthma medication and your inhaler. You're going to have it for the rest of your life. By age 6, I developed severe allergies. Next up was antihistamines, in which I would take them about a third of the year because my allergies were so bad. And I started to develop ear infections and strep throat. Guess what I took for that? Antibiotics. I did that for a few years, and then I developed severe irritable bowel syndrome. So guess what I did for that? Took anti-diarrheal medication every single day. By the time I was 15 years of age, all my joints hurt, so doctors recommend I take non-steroidal anti-inflammatory drugs, which I did to the tune of about 6 to 8 every single day. It wasn't long after that I developed severe tinnitus ringing in my ear. I actually did a bunch of testing, couldn't figure out what it was, so they just told me, you're just going to have to learn to live with it. By the time I was 20 years of age, I'd already had 2 joint reconstructions on my shoulder and on my ankle because I was just perpetually hurt and perpetually injured. And then when I was 21 years of age, during a summer in which I was working 60 hours a week in a factory, sleeping about 4 to 5 hours and eating McDonald's every single day, I mysteriously caught strep throat. They gave me an antibiotic for it, and then it came right back. In fact, I was on antibiotics for 120 days before the doctors just threw up their arms and gave up and said, we're just going to rip your tonsils out. Oh, by the way, I almost died on the operating table because it's a pretty severe surgery when you're 21 years of age. Not one doctor ever asked about sleep, never asked about diet, never asked about nutrition, and never was concerned about why I was so perpetually inflamed. It was just a reductionist approach, saying, take this for that. And it's kind of like coming to the scene of an accident and seeing skid marks and coming to the conclusion that skid marks actually cause accidents. Fast forward 20 years later, I don't take asthma medication, I don't take allergy medication, I don't take pain medication. In fact, I don't take any medications whatsoever. And despite passing on my poor genetics to my kids who have over 44 years of life experience, they've never been on a drug, they've never been on an antibiotic, they've never been on an inhaler, they've never been on anything. So when we talk about causes, the reality is it's not a this for that approach, which is why so many people stay sick in healthcare. In fact, if you start looking at the body as a Swiss watch and you start identifying how the immune system works, how it responds to inflammatory triggers, how mental stress plays a role in immune system function, and how every organ system is dependent on every other organ system for healthy function, then you can start to scratch the surface as far as root causes of disease. It's time to take our mindset out of the Mercedes 80s when it comes to healthcare, when it comes to getting better. We can do so much better.